As we are facing a great challenge of caring for a patient with COVID-19, we as healthcare professionals need to protect ourselves while taking care of a patient. In this video, we are going to demonstrate the use of personal protective equipment while caring for a patient with COVID-19. It's very essential that we protect ourselves and we use the PPE appropriately. At the same time, we need to use it very judiciously. Let's begin the video now.
We will start with donning of PPE. It is not a sterile procedure. Donning is to be done in a designated donning area. Coming to the preparations for donning, ensure that you are hydrated and that you have had food. Use washroom if needed. Keep all articles needed nearby. You will require the PPE kit, the alcohol-based hand sanitizer, some extra tapes, surgical mask and gloves. Change into surgical scrubs. Use washable shoes if available. Tie up your hair. Take extra items off the pockets of your scrub. If you wear glasses, secure them properly. Ensure you are not wearing any jewelry. Perform hand hygiene. Wear the N95 mask. We are wearing the mask first here as we are near to the COVID unit, and this would prevent or minimize the exposure of the air to the healthcare worker. For wearing, hold the N95 mask by placing the cup of the mask in one hand such that the strings fall downward. Place the cup of the mask on your face such that the nose and mouth is covered. Pull the lower tie upward over the head and take it till the nape of the neck. The upper tie goes to the top portion of the head. Fix the flexible band on the nose bridge. Now, fit test. Negative fit test can be done by taking multiple deep breaths. Look for dimpling of the mask. Positive test can be done by blowing air out while holding two fingers over the mask. Look for any significant air leak. Next is wearing the shoe cover. Sit comfortably on a chair. Take the leggings and wear them. The leggings should reach at least till mid-calf. Now perform hand hygiene and dry hands. Wear the first layer of gloves. The first layer of gloves should be snugly fitting. After wearing the gloves, inspect for any damages. Wear protective goggles. The buddy can inspect for proper fit of the goggles. If the person wears a specs, the goggles should completely cover the specs. Next, wear the gown or suit. Some PPE kits may be provided with a gown. The buddy helps to ensure that the gown or the suit is worn properly. The wristbands of the gown can be tied or taped to the first pair of gloves. Check for mobility. Wear the apron if it is provided in the set. The apron can be tied in the front for easily removing during doffing. Wear the second pair of gloves. The second pair of gloves is worn over the first pair. Ensure that the second gloves covers the wristband of the isolation gown. It is advised to have a different color gloves than the first pair. The buddy inspects the healthcare worker for any breach in PPE. The healthcare worker is now ready to enter the COVID area. There are some safe work practices to minimize our chances of contamination when we are working in a COVID designated area. We have to keep our hands away from our face. We should limit the surfaces touched. The more the surfaces that we touch, the greater will be our chance of taking in a contamination. If our gloves get visibly contaminated or torn, we have to change gloves immediately. Even though we are wearing PPE, we have to perform hand hygiene frequently.